Every week, another headline drops about Ozempic, Wegovy, Zepbound, the GLP-1 drugs reshaping weight loss. Most people think the technology has peaked, that future drugs will just be minor tweaks. GLP-1 drugs are seen as the most advanced option for weight loss and diabetes, with only minor improvements expected over time. But Retatrutide changes that belief completely. It's not just better, it's a totally new breakthrough. This isn't a GLP-1 drug with a fresh coat of paint. It's the first triple hormone agonist that rewrites the entire playbook by targeting 3 pathways simultaneously instead of 1 or 2. By the end of this breakdown, you'll understand exactly how this triple mechanism works, why it solves problems current drugs can't touch, what the clinical data actually reveals, and the hidden risks that aren't making headlines yet. The speed advantage. Speed matters in weight loss, and Retatrutide changes the timeline completely. At the 8 mg dose, participants dropped nearly 18% of their body weight in just 24 weeks. At 12 mg over 48 weeks, the average hit 24.2%. Put that in perspective, Tirzepatide, the current gold standard, reaches about 21% weight loss, but it takes 72 weeks, not 48. Retatrutide achieved better results in significantly less time. And that's only the beginning, because the real secret is just ahead. The triple mechanism revolution. Most weight loss drugs work on one pathway. Semaglutide hits GLP-1. Tirzepatide adds GIP. Both are powerful, but they're only addressing half the metabolic equation. Retatrutide activates 3 hormone receptors simultaneously: GLP-1, GIP, and Glucagon. Think of it like completing a circuit instead of traveling on a one-way street. GLP-1 and GIP receptors are found in the brain, in the digestive system, and in the pancreas. When these are switched on, they reduce appetite, slow digestion, and help the body use insulin more effectively. Glucagon receptors are mainly in the liver, with smaller amounts in the kidneys and brown fat. When activated, they release stored sugar, burn fat, and increase heat-producing metabolism. Older drugs mainly turned down hunger but didn't do much to increase calorie burning. GLP-1 and GIP quiet the brain's food cravings, while Glucagon tells the liver and fat cells to release stored energy even when the person isn't moving. This mix makes Retatrutide more than just a small improvement. It's a whole new approach. Instead of only helping someone eat less and hoping their metabolism adjusts, Retatrutide actively makes the body burn its stored fuel. It doesn't just change eating habits, it changes how the body handles energy at the cell level. And this triple approach solves a dangerous problem current drugs create: the hypoglycemia fix. Blood sugar crashes are one of the scariest side effects of GLP-1 drugs. When appetite suppression and insulin sensitivity increase dramatically, blood glucose can drop too low, especially at night when someone isn't eating. Some users wake up shaking, sweating, and confused. Retatrutide's glucagon activity creates a built-in safety mechanism. While GLP-1 and GIP work to lower blood sugar and improve insulin response, Glucagon simultaneously releases glucose from the liver when levels start dropping too far. And this next advantage might be the most important for people who've already tried everything. The non-responder solution. Up to 30% of patients on GLP-1 drugs see minimal or disappointing results even at maximum doses. They follow the protocol perfectly, tolerate the side effects, stay consistent, and still plateau early or barely lose weight at all. For people who didn't get good results with other drugs, Retatrutide offers something truly new. It activates the glucagon receptor, a pathway that drugs like semaglutide and Tirzepatide don't touch, giving the body a whole new way to boost metabolism. And surprisingly, this more powerful drug might actually be easier to tolerate. The tolerability surprise. GLP-1 drugs are notoriously rough on the gut. Nausea, vomiting, bloating, sulfur burps, severe constipation. These side effects cause 10 to 15% of users to quit treatment entirely, even when the weight loss is working. Retatrutide uses weaker binding to GLP-1 and GIP receptors to make room for glucagon activity. That softer touch might translate to fewer severe gastrointestinal side effects. Tolerability isn't a minor concern. It's the difference between a drug someone can actually stay on long-term versus one they abandon after 3 miserable months. And that distributed mechanism comes with a trade-off most people won't see coming: the appetite suppression trade-off. People on GLP-1 drugs say the noise in their head about food goes away. Cravings stop, they think less about eating, and hunger feels quiet. That calm feeling matters as much as losing weight, because retatrutide binds more gently to GLP-1 and GIP receptors. The appetite suppression effect may not be as dramatic. People who relied heavily on that complete shutdown of food thoughts might notice they still feel hungry and think about meals. Retatrutide isn't just another incremental improvement in the GLP-1 space. It represents a fundamental shift in how metabolic disease gets treated. By combining GLP-1, GIP, and glucagon pathways into one injection, it creates a complete metabolic circuit that reduces calories while actively increasing calories burned. For people who are on maximum doses of semaglutide or tirzepatide, for those who couldn't tolerate the side effects, for anyone who needs faster results, retatrutide could be exactly what's been missing. If this breakdown changed how you think about weight loss drugs, drop a comment about whether you'd try a triple agonist once it's available. And subscribe, because metabolic medicine is evolving faster than most people realize. The next few years are going to bring breakthroughs that make today's options look primitive.